Every single child that I treat, I always think, what would I do if this was my child? The brain science tells us that 85% of a child's brain develops by the time they're 3 years of age. What happens in those early years directly translates into success later on. As a pediatrician, we screen for developmental issues starting from a day or two after they're born. There are some motor skills that we really want to work on him with. It allows us to really support and cheerlead the areas where children are excelling. And it also allows us to identify areas of concern.
My wife and I have a 3-year-old son. His name is CJ. And we bring CJ to see Dr. Long about every 6 months.
How are you, CJ?
Good.
So that we can not only keep track of his physical development and checkups, but his mental development as well. It's very comforting to always know where we stand as parents and where he stands as our son in terms of his overall development.
Child development is a broad spectrum. Every child fits somewhere on that spectrum. And it is the parent, the caregiver, that can answer these developmental questions because they are with the child every single day. And based upon that parent's expertise on their child, we can determine, is this child on track developmentally? Are there gray areas where we're concerned? Or are there big red flags where we actually need to identify what the issues are and then refer that child for interventions?
Exactly.
It sounds like he's right on track.
Oh.
And so the fundamental question is, how do we create programs that allow for every single child to have access to screening, referrals, interventions that promote their development?
Dr. Long uses a really interesting development screening tool. It helps measure CJ's strengths and weaknesses in terms of his overall mental and educational development. And it's great because it helps us focus on the areas of improvement that we need to make as parents, but it also helps us identify the areas where he has strengths, and we hope to continue to develop so that when he goes on to middle school, to high school, he'll be able to use those strengths to his advantage.
The law requires that pediatricians do developmental screenings. There are barriers for pediatricians to implement this law, and it is essential that we support pediatricians in doing these developmental screenings. The return on investment for allocating resources and advocating for early childhood care are huge in their impact on economic outcomes, health outcomes, and educational outcomes. And you're doing an awesome job. And I'm totally here to help and support you.
Thank you.
Okay, thank you. I consider myself to be an advocate because I advocate for each and every patient that I see. It's childhood that maps the course for someone's adult outcomes.